Hey guys, it's me again, CC Rex here at STM LLC here on YouTube. So, for this subject matter, we're going to talk about massage as it pertains to bedridden populations. So, let's go ahead and get to it. So, what is bedridden? So, when you are in your bed and confined to your bed, where you take your meals, that's where you do your bathing, that is where you use the bathroom. It's because you have the incapability of moving out of that space. So anytime that is occurring in someone's, life, and it's usually on a more permanent basis than not, we call that bedridden. So it's to be confined to your bed. It doesn't allow you to move around a whole lot. And within that, it causes maybe some stiffness in the muscles from them not being moved, but it also causes blood flow difficulties, right? So being able to move your muscles helps to pump your blood through your veins. So laying or sitting for long periods of time without movement causes blood flow to slow down and collect or pool, right? So that pooled blood, that causes a reduction in blood flow. And if a person is in a bed or even a wheelchair for an extended period of time, they can develop bed sores. And I mean, even if they're in wheelchairs, they're still called bed sores because it's just the most common name for it. You have what is also like bed sores are also called pressure ulcers, and it's because you have that constant pressure on that given area over lots of time. I can't even quantify it, just a good amount of time. Bed sores are in areas they damage the skin and the tissue because there's really no way to move. You're sitting there, you're laying there, and that's the position that one that's probably most comfortable for your body is just not the most helpful in preventing pressure ulcers. Excuse me. The pressure ulcers or bed sores are more likely than not found in places like the back, the glutes, or the butt area, hips, or even legs. And they have like different degrees and different stages to these ulcers, right? So the first stage is like the skin, it can feel warm to the touch. And then there like is a color change and it adds like a little bit of redness, and it can also be a little bit itchy. Another stage is like you have like a painful or open sore. And a blister kind of starts to form. And that blister may have like some discolored skin around it because before then there was that pressure. So the blood had already started to pool. It had already started to just kind of sit there. So even around that area, you might have some different colors than may look normal for a body. You have a place in the stage where a lesion can develop, and it's kind of like a crater. It's crater-like in appearance, and it's because the tissue underneath is just damaged. Like it hasn't been getting oxygen, it hasn't been flowing, it hasn't been pumping. So that skin underneath all of that area is just really damaged. And then in even more severe cases, you have damage to the skin and to the tissues, and it probably has an infection because if you haven't been getting the proper oxygen to that area, if you haven't been getting the movement in that area, you have all kinds of bacteria that can just sit there and be allowed to like grow. And that at that stage, you can probably like see some muscle or some bone or some tendons. You like it's definitely been opened up to where you can see those structures. Common complications if it gets to that stage are like things like pneumonia, constipation. You can have like reoccurring urinary tract infections, or just like some shortening of the muscles in and of themselves because they're not in their typical environment where they're one fully covered, warm, and having blood being allowed to flow and pump through so that they can remain at what they need to be to function properly. In order to reduce the chances of having like anyone go through this, anyone of these stages, there are measures that can be taken. Some of those measures include changing your position every 15 minutes if you're seated, and maybe every hour or two if you're in a bed. Understand it's not easy to always like move and shift every 15 minutes, but as close to that as you can, making sure that you are like moving around so that you don't have a chance to keep that sustained pressure on those areas, causing you that discomfort, causing you to maybe go through one of those couple stages where you're just not doing the best by like your skin, your muscles, and your tissues. Another thing is if you have a caregiver, just to have them check you regularly. Um, Keep your skin clean and dry. I understand again that sometimes you may have to use the restroom from your bed and you're not really able to help that, but making sure that you have the cleanest linens and all bedded materials be as clean and as dry as they can be so that you can avoid or try to sidestep something like this happening. Um, the last thing, I don't think you'll be surprised to hear me say it all. Get light massages. You don't have to go in and get a deep tissue. You don't have to, get like the craziest forms of work. Even the lightest effleurage or petrissage can help a great deal if you're just trying to get fluids to move around throughout the body. And taking the time to understand like what that looks like, from somebody who's going to give you the best guidance possible. If you have a massage therapist that you know or could look up that may work within this area and can maybe even teach your caregiver to give you a light massage over certain areas, that would be greatly beneficial and reduces your chances greatly of developing bed sores. Again, like with every other video, there's an ebook that comes along with this, and it's actually catered towards the caregiver. So that caregiver may be a CNA, it may be a family member, it may be a friend, whatever that looks like. So it's the caregiver's guide to massage. So teaching the caregiver some effective techniques to prevent those pressure ulcers, and having them, one, understand them, what they are, how they present, the role of massage therapy in caring for people who may develop these pressure ulcers, effective techniques, case studies on how massage helps, with these conditions. Because one, it's not something that has to be, again, you don't have to pull out a table and take an hour, but if you had like maybe 5 or 10 minutes at a time where you could go over certain areas, especially areas that that people are on a good majority of their time in either their wheelchair or their bed, it would make a vast difference in how they feel, their attitude, and if they're in a road that they want to even get to a recovery point, it would help, vastly in that point. Um, it would also help, like, if people had nursing home issues around bed sores, it would help you kind of stay out of that line of trouble with authorities. If you could just have somebody or have them learn, have your CNAs learn, have the caregivers learn how to administer those proper techniques so that your residents are more comfortable, so that, everything is a little bit more copacetic. That's all the time that I have for today's video. If anything that I said you have questions about, you can drop those questions in the comments, and I'll be more than happy to answer them. If you haven't taken the time to subscribe, I ask that you subscribe. So if this information benefits you or someone you may know, that everybody is getting it and everyone is reached. Again, this is at STM LLC on YouTube. I'm CC Rex, and I will see you in the next one.